thank you so much for both allowing the testimony and for your careful attention to the testimony of incarcerated people. I found it very, very moving and so important. I am the Director of Solitary Confinement Programs for Prisoners' Legal Services. I sit on the statewide Restrictive Housing Oversight Committee, so I've had a front row to implementation of the Criminal Justice Reform Act. I presented lengthy written testimony on behalf of PLS, the Committee for Public Counsel Services, and the Disability Law Center in support of the H2325, S1493, the Rehabilitation, Reentry, and Human Rights Bill. As Senator Miranda said, the system's not working for anyone. And you heard this both from people inside the prisons and also from some of the staff. And I think what all of this points to is that true safety requires, for incarcerated people, staff, and communities, requires ending of this punitive, inhumane conditions and ending the deprivation, the programs, education, and necessary medical and mental health care, substance treatment. So I want to turn first to some of the punitive conditions. The CJRA tried to regulate solitary confinement, and we saw some welcome steps with the elimination of the DDU. But as you've heard, these new units that have been created are, nobody considers them rehabilitative. They're supposed to be rehabilitating people, but you heard from people, they feel punished. They're not getting what they themselves know they need in order to move forward. And this bill would give them that. It would require minimally humane treatment as well as necessary care. Really, what we're talking about is our priorities here. We spend over $138,000 per person in the DOC, over $100,000 in the counties, but programs only account for 2 or 3% of these budgets. Meanwhile, overtime correctional costs are massive. And as it was said before, we're one of the most heavily staffed correctionally staffed systems in the country. So my time is up. My written testimony is lengthy.